first, as we were researching this talk, I was stunned to come across the treatment that I eventually got, high-dosage interleukin. This is from the website.
We determined that it was kidney cancer, by the way. That was the primary source of the cancer. Sorry.
Yes. And so astoundingly, this diagram, this is textbook, stage 4, turned out to be grade 4, renal cell carcinoma. This diagram exactly matches what I had going on, except that my primary tumor was in the other kidney. My first physical symptom was 6 weeks after that X-ray, when my left femur started hurting, and it turns out it was a bone met that was so far advanced that in early May the leg just broke. So I have a nice steel leg now. Turns out I also, there's the one that showed up in the shoulder X-ray, number 4 up in the corner. Turns out I had one in the skull as well. And then, if you'll advance, Danny, there were a few more lesions tossed in for extra credit, more in the lungs, one in the iliac, one in the ulna. As the leg got bad, I couldn't use a regular walker because I couldn't put weight on that. And meanwhile, we own 2 houses, and I'm on diminished income because I'm missing work. Lots of fun. And the week before my treatment started, a tumor erupted from my tongue, which is a pretty gross thing. And it's just an indication, those of you, some of you may know that an intramuscular metastasis is very rare. It only happens in the most aggressive cases, and of all the delightful places to have it happening. Fortunately, that was just a few days before. Now, one thing, this really drives home for me the fact that I didn't just wait till I got to the doctor's office to ask for that referral. All right, because if I'd waited until I had my first physical symptoms 6 weeks later, we wouldn't be having this talk. There's no question in my mind.
Dave, you told me something, we were talking about this earlier, about how you felt knowing that you had this metastatic cancer with, a few months to live, potentially.
Well,
you're going to tell that a bit? Okay.
Yeah.
I guess this was, yeah.
So once we had the diagnosis, I'm an inveterate internet user. I've been doing online stuff since CompuServe, before the web was born. I Googled my butt off, you can believe. And I said, I am going to find, I didn't like what I read on the first few websites. I'm going to find information on how to beat it. And so what I eventually found, well, you go into this game and you gotta score your disease basically on various prognostic factors. And so as I educated myself, I found like a score sheet of, has your weight been dropping? Has your appetite been dwindling? All right? These things that I thought were favorable news, like have you been suffering a loss of energy? And as I added these things up, what I found was that the median survival time for my condition with those prognostic factors was 24 weeks after diagnosis. And 2 of those weeks had already gone by. Now, I know enough about statistics to, that's one of the things that just irks the daylights out of me about the conventional, well-established, peer-reviewed, blah, blah, blah websites. And mind you, I'm an MIT graduate. I understand being methodical and scientific thinking and so on. But for Cripe's sake, give me information that's going to make a difference, not the most recent randomized double-blind study. Right? What I asked, I went to ACOR and I asked my community, what about this survival, this median survival time? They steered me, not even my doctor, steered me to this wonderful article called by Stephen Jay Gould called "The Median Isn't the Message," which reminded me what I learned in statistics class. The median is like out of 25 people, it's the 13th one who died. It tells you nothing about the outliers. It was in ACOR where I got the answers that were relevant to my world.
You want to talk about ACOR a little? Because that's important.
So this is just the homepage of ACOR, support and resources, types of cancer. Within types of cancer, you click the K and you get kidney oncology at the bottom. And it's just a terrific community. Go ahead to the next slide. So I emailed this to Danny. So, compared to the length of time it takes you to get an answer out of the system, I posted 2 messages tonight, got responses in 4 and 11 minutes. All right? One responder sent a private note mentioning Robin and Kathy, the two women who run it, and one was from Kathy herself. Think about something. A large part of the conversation at all these conferences that I've been attending around Boston is who's going to pay? Do you know how much everything that we've just been discussing here costs the system? Right? ACOR is free. And by use of patient site, it's buried somewhere in the Beth Israel Deaconess cost structure, but there is no incremental cost, and that keeps showing up here.
So Dave, of course, went beyond my advice to him because he loves this stuff, and he actually set up a blog and a website. Do you want to talk about that? Because this was really extraordinary.
So a lot of people know about CaringBridge now, but 2 years ago when this all started, it wasn't as well known. Fatefully, this CaringBridge started in Minnesota. It's a suburban Minneapolis company. And I had lived there, and somebody at work knew a patient who had set up a CaringBridge community. So being an online kind of guy, I immediately did this. If you've been through or you know somebody who's been through an adventure like this, you know that one of the tasks, one of the chores you take on is keeping people involved. With all your siblings, family, friends who are saying, oh my God, what happened to Dave? And what you can do on CaringBridge is post things in a journal, just post updates like a blog. It's not really a blog, but it's like a blog. And people will get email notifications. They can then come and post notes in the guest book, which is sort of a separate comments column. And it was terrific. And once again, it's free. You know, it's funded by some hospitals and other donations.
And Dave told me he'd set this up, and I went, of course, there, and I logged into the guest book. And I also said I want to receive journal updates. And it was really fascinating to, although I'm getting all the medical updates, of course, the other doctors taking care of him, hearing his updates through this to his families and friends, not necessarily to me, was really fascinating. It gave me a very interesting view into his life through this journey.
Before we want to move ahead, I want to add one more thing. There's a use of patient site that a lot of people don't think about, and I made a lot of use of it. I would give my password, for instance, to my wife, who's a veterinarian. She knows I'm not a dog, but she has a lot of experience with mammals. And she could read my lab results and understand what was going on. Right? I had friends who were MDs in other parts of the world. What I got was the experience of being connected, not alone, again, at no cost to the healthcare system. It wasn't always good news. One friend overseas, whose brother is a top physician in Israel, basically told him that I'm screwed. Seriously. But again, just the thing that as I talk to people about what we can do with connected health that will add the most value at the least cost very quickly is just bringing information to people, just opening the doors and letting the information come together. In the case of ACOR, I went to that Prolucan website and I read the dry statistical stuff. I don't think we have a slide about this, do we? But it said the side effects include bing, 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 nausea, diarrhea, flaking skin, blah, blah, blah. The side effects are often severe and rarely fatal. Well, but it doesn't sound nice, but it's information I needed to have. If I needed anything, I needed to be in touch with reality. But that still didn't let me know. That's sort of like reading the dry crash report data on cars. I went to the ACOR community and I said, okay, who's been through this treatment? What's it really like? And within a couple of days, I had 17 stories sent to me, which I accumulated into a Word file, and every couple of months I get a request for that file again. And what that meant was, I knew about this thing called Rigers, which is like you're shivering like crazy. Spelled like Riggers, it's Rigers. And so when that hit me, when that first bag of interleukin went into me, I knew what was happening, and I knew that the nurses would bring warm blankets and cover me up, that I would continue shaking for about a half an hour while I was warm even, and then it would be done. That is so different from just saying, what now? There's real value in that sense of community.